I'm here to talk about opting out of Medicare, and I know that a lot of you are standing at the fork in the road at this point trying to decide what to do. And as Yogi Berra would say, when you come to the fork in the road, take it. And here's what the fork in the road looks like. There's APM going down one road, another road goes down to MIPS, and we'll talk about both of these on the next slide. And of course, the final path leads to freedom, and that's what we're talking about as far as opting out and running third-party free practices today. So APM, the Advanced Alternative Payment Model. It's advanced, it's modern, but it's based on the old feudal system involving lords and serfs. And guess what? The physicians are the serfs in this scenario. It represents capitation on steroids with bundled payments, where, for example, the accountable care organization that may be run by a hospital insurance company, then deciding what little tidbits to dole out to the physicians. And the other thing to know is that the APM entity and its physicians bear substantial financial risk for monetary losses. And so, if you don't join one of these advanced alternative payment models, your only other choice, if you're in the Medicare system, is the merit-based incentive payment system. And without going into it in too much detail, basically it's a very complex system designed to put solo physicians and physicians in small groups out of business due to extreme difficulty and cost of complying with the complex scheme. And basically both of these pathways are designed to put solo and small group physicians out of business. And so here are the things that go into making the MIPS composite score. So physicians in this system will be given a composite score as to how well they comply with these various factors. And if you look at the table below, it shows the Medicare conversion factor as well as the MIPS adjustment factor. And you can see that 2020 and beyond, you're in for a tremendous Medicare conversion factor update of 0%. And if you look below the MIPS adjustment factor, if you're not compliant with jumping through all of these hoops that they want you to jump through, by 2022, those doctors who don't comply are looking at a 9% fee cut annually. So more and more physicians are choosing to opt out of Medicare. The top graph shows on a year-by-year basis the number of physicians who have opted out of Medicare. And the bottom graph shows the cumulative number of physicians who have opted out of Medicare. And as you can see, there's certain little blips here, sometimes a big blip. Obamacare was passed in 2010, and then I think most of it started being implemented around 2014, and you can see that the annual rate of physicians who opted out went up rather dramatically around that time period. This next graph shows the distribution of opted out physicians by various specialties. Psychiatrists lead the list. It's over 2,400 psychiatrists have opted out of Medicare. So let's go over some of the basics. What are your Medicare payment options? Well, you can be a participating physician, and probably 90% or more of the physicians in this country are currently participating physicians. Non-participating physician, an opted out physician, or you can be a disenrolled physician from Medicare. So let's talk about each of these. The participating physician is an enrolled physician who signs an agreement with Medicare agreeing to accept assignment on all Medicare patients and to accept as payment in full for medically necessary covered services as defined by Medicare. The non-participating physician is an enrolled physician in Medicare who does not sign such a contract with Medicare and may choose on a case-by-case basis whether or not to accept assignment. If the non-participating physician decides not to accept assignment, the physician can bill up to the limiting charge for whatever service is provided. And an opted out physician is an enrolled physician who chooses to opt out of Medicare by filing an affidavit with the Medicare contractor. and neither physician nor patient can submit a claim to Medicare except for emergency or urgent services for any services provided by the opt-out physician during the opt-out period. And Medicare limiting charges do not apply for the opt-out physician. You can set them at whatever level you wish. Opted-out physicians who have an NPI can order tests and make referrals to other entities or physicians who are in the Medicare system, and Medicare will pay as per Medicare policy. And then opted-out physicians, one of the things you have to know is you cannot make a new contract, a new private contract with a patient in an emergency or urgent situation. So in those situations, you basically become the same as a non-participating physician, and in those situations, you can file a claim with Medicare either on an assignment basis or a non-assigned basis. And if you file it on a non-assigned basis, of course, the limiting charges apply. So one of the things to note is that both participating and non-participating physicians are subject to all the rules, regulations, and policies governing the provision of services in the Medicare program. And opted-out physicians are not subject to all of these 132,000 pages or however much it is now of the Medicare rules, regulations, and policies that apply to par and non-par physicians. So you're not subject to the correct coding initiatives and all the other strange, bizarre things that Medicare uses to constrain costs. And the federal balance billing law provides that non-participating physicians can charge 115% of the non-par allowed amount, but you have to recognize that the non-par allowed amount of the fee is 95% of the par allowed amount. So it amounts to about 9.25% above the par fee, and you need to collect 100% of that if you're going to earn 9.2% more income over the year, for example. And some have estimated that you might have to collect the full billed amount by 35% of the time in order to equal revenues received by a par physician for the same services. Now, some states have passed state Medicare balance billing laws to further limit payment to physicians, and those include Connecticut, Massachusetts, New York, Ohio, Pennsylvania, Rhode Island, and Vermont. In New York State, for example, the state balance billing law lowers the balance billing limit by 5% so that non-par physicians can bill only 105% of the Medicare allowed amount, which when you take all into consideration, what ends up being is that the non-par physician in New York State can only charge 99.75% of the par fee. So what has happened to Medicare fees under MACRA? Well, it's not just the par and the non-par and the limiting charges under MACRA, which was passed in April of 2015. Under MACRA, as I showed in some of the previous slides, you're subject to the merit-based incentive payment system. And again, if you're not compliant with all of the hoops they want you to jump through with that, you're going to be looking at an annual fee cut of 9% by 2022 and beyond. So there's a lot of physicians that we hear from and say that I would really love to opt out of Medicare, but I really can't do it in my area. I'm surrounded by competitors, all of whom participate in Medicare, and all of my Medicare patients will leave and go to my competitors if I opt out, and I will be out of business. And what I'm here to tell you today is that fear of what may happen if you opt out of Medicare or if you stop signing abusive, one-sided contracts with insurance companies is the fence that confines you in the pen. And for those physicians who are a little hesitant about taking the leap into opting out of Medicare, we've developed the pinky toe approach for opting out of Medicare. And so that's like you kind of dip your pinky toe in the water to test how cold it is before you jump in. And the way this works is basically you can conduct a brief written survey of Medicare patients as they come into your office. The brief survey serves a dual purpose. It helps to educate your patients about how the Medicare bureaucracy adversely affects them, and it informs them about the substantial benefits of being treated by an opted-out physician. So I'm not going to read this to you. It's all in your packet. But basically, this is what you can use as far as the survey and edit it to accommodate your own private practice. And then basically you ask two very simple questions. Number one, in view of the fact that government interference in medicine will continue to restrict our ability to provide you with the quality care you deserve, would you be willing to receive higher quality care provided by an opted-out physician? Ask for any comments. Question number two, in view of the fact that you are already paying substantial Medicare deductibles and copays out of pocket for government rationed care, would you be willing to pay a little more out of pocket to receive better care? Such things as getting in to see the physician sooner, having more face-to-face time with the physician so that all of your questions and concerns can be appropriately addressed and answered. And again, ask for any comments. So you can adjust those, edit those however you like to suit your own private practice. It turns out that spending more face-to-face time with patients as an opted-out third-party free physician may result in fewer malpractice claims. And this was a story by the New York Times in 2015 entitled, "To Be Sued Less, Doctors Should Consider Talking to Patients More." What a novel concept. It turns out, though, that patients do appreciate more face-to-face time with an actual, real, live physician. And then there's the risk of prosecution, prison, and ruinous fines. You have a whole host of little armies out there looking to get you. You have recovery audit contractors, the RACs. These are private bounty hunters. They get a percentage of the take for whatever they bring to Medicare to say that you have inappropriately billed Medicare and you have to send them money back. They get a percentage of that. Then you've got the zone program integrity contractors, the ZPICs. These people are looking for crimes. They're looking to hook you up with some handcuffs and put you in jail. Then you've got the FBI Healthcare Fraud Task Force. And of course they have jurisdiction over both federal and state insurance programs, and they have 56 field offices. And in addition, you have the Medicare contractors' own fraud units and the HHS Office of Inspector General looking at all the claims that you send in to see if there's some discrepancy that they can basically turn into an inappropriate or fraudulent claim. What are the effects of Obamacare been? Well, it's increased the federal sentencing guidelines by 20 to 50% for crimes over 1 million in losses. It's increased license checks and site visits for physicians deemed to be high risk for fraud and abuse. CMS has implemented advanced predictive modeling technology to detect fraud, and it's provided an additional $350 million over 10 years to boost anti-fraud efforts, largely against physicians. And as I mentioned, spending more face-to-face time with patients is something that you can do as an opted-out physician and makes patients much happier. So what has MACRA brought us? And one of the things that MACRA has brought us, it turns out to be a good thing, is that now there's an indefinite continuing automatic extension of the opt-out election. So physicians can now permanently opt out of Medicare. That's a big thing. You don't have to file this affidavit every 2 years anymore. And if you forget it, it was a big deal and they could come after you. So I've posted my letter on the wall of my office, very proud that I have the permanent opt-out letter from Medicare. Also, you no longer have to renew private Medicare contracts every 2 years with patients. That used to be kind of a hassle too. Every 2 years you had to get the patient to sign a new private contract for the new 2-year opt-out period. You don't have to do that anymore. It's a one-time deal. They sign the private contract and that's it. So what are some of the factors to consider in making the opt-out decision? There's both financial considerations as well as non-financial considerations. And most importantly, I think you need to consider the total revenue equation. That is, gross revenue minus expenses equals net revenue. So Medicare often costs physicians a lot in terms of administrative costs, having to deal with the carrier, resubmit claims, make appeals, and argue with pin-headed bureaucrats who have basically no medical training at all as to whether something's medically necessary or not. And once you jettison that horrendous administrative cost of dealing with the Medicare bureaucracy, you need not raise fees that much to be able to make a decent living. So you need to look at the type of services you provide, the patient population you serve, and make some assessment about the ability to collect directly from your patients. And if you elect to stay in Medicare, you also need to look at the other side of the coin. That is, how much is it going to cost you and your staff to try and comply with all these hoops that you have to jump through in order to avoid a 9% annual fee cut? And if you decide to opt out, it may be helpful, often is helpful, to kind of find a niche service, something that maybe Medicare says is worth zero, and something that patients value. And the niche service that all of you have to offer is more face-to-face time with the patient. They like that. They don't necessarily want to talk to a PA or an NP or the secretary sitting at the front desk for their medical care. They would like to see an actual, real, live physician. So what are some of the non-financial considerations? Well, number one on the list is the freedom and pleasure of practicing medicine again. I mean, who went into medicine to practice bureaucracy? Yeah, nobody. And number two, positive patient experience and protecting patient privacy. No fear of ruinous fines or prison time for inadvertent coding errors or running afoul of some obtuse Medicare law, rule, or regulation. Simplification. Opt-out physicians need not use any CPT codes, ICD-9 codes in serving Medicare patients. There's no claims to file, no more constant Medicare hassles, more time to spend actually treating patients, and importantly, more time to spend with your family. Basically, it's experiencing the joy of practicing medicine again. And in making your decision about opting out of Medicare, you should check all of your contracts, of course, and hospital bylaws to ensure that there are no conflicts. And if you're unsure, of course, ask an attorney to review your contracts and any other legal documents that may be pertinent. So opting out is really as easy as 1, 2, 3. Number one, you download and print out the opt-out affidavit from the AAPS website, aapsonline.org. You fill out and you sign the affidavit. Then you mail the affidavit, certified mail, return receipt, with a cover letter requesting acknowledgement of accomplishing the opt-out of Medicare to the Medicare carrier or carriers that you deal with. So that's it. Easy as 1, 2, 3. The procedure for opting out is a little bit different for non-participating versus participating physicians, just in terms of timing. The procedure itself is the same, but the timing's a little different. Non-participating physicians can opt out of Medicare any time during the year. And although it says that you can make your first contract, or you can opt out no later than 10 days after the first contract you've signed with a patient, I would highly recommend that you not do that, that you have opted out of Medicare entirely before you make the first contract with a patient. And participating physicians, however, can only opt out of Medicare 4 times during the year. And the Medicare contractor must receive the opt-out affidavit 1 month before the beginning of the next calendar quarter. So the deadlines for the Medicare carrier receiving opt-out affidavits are March 1st, June 1st, September 1st, and December 1st. And again, remember, it's like that scene in the Mafia where the guy says, you know, just when I thought I was out, they pull me back in again. Well, it's a little like that for opt-outs, again, that in emergency and urgent situations, you cannot make a new contract with a patient. And again, you can send a claim in to Medicare for those emergency services, and you're treated like a non-participating physician when you do so. There is an early termination of the opt-out that's available, but it's only for those who have not previously opted out of Medicare. And the physician must notify all Medicare carriers of the termination of the opt-out no later than 90 days after the effective date of the opt-out. If you do that, you must refund to each beneficiary with whom you have privately contracted all amounts collected in excess of the Medicare limiting charge. Pretty big hassle, but if you feel you want out, that's the cost. You also must notify all beneficiaries with whom physicians entered into a private contract of the termination of the opt-out and beneficiaries' rights to have claims filed on their behalf for services provided during the opt-out period. So you have to go back and file claims for that 90-day period if you elect for the early termination of the opt-out. The physician is then reinstated in his prior Medicare status as if there had been no opt-out. And again, as I mentioned, you can download the step-by-step instructions from our AAPS website. You will also find a list of physicians on our AAPS website who have opted out. And there's videos of talks given by opt-out physicians in various specialties. And you can contact these physicians if you're in that same specialty and have questions, and they can help answer those for you as far as how it's worked or not worked in their particular specialty. So what about hospitalizations, labs, radiology tests, supplies, and home health care? Well, physicians who are currently in the Medicare system, either as a participating or non-participating physician, who opt out of Medicare, they already have an NPI number and are in the PACOS database. The PACOS database is the Physician Enrollment Chain and Ownership System. Notice those two words, chain and ownership. They own you. They've got you in chains. But they have a database called the PACOS database. And generally, if you have an NPI number and you're in that PACOS database, you should generally have no trouble having Medicare pay for hospitalizations, labs, radiology services, or home health care services. And again, there's the website to check to see if you're in the PACOS database. There are other websites as well that you can check. Medications and referrals to specialists are generally excluded from the Medicare ordering and referring rule. However, opted out physicians who do not have an NPI cannot get Part D drugs covered by Medicare. And again, physicians who have never enrolled in Medicare do not have to enroll in Medicare in order to opt out. Also, for physicians who are not enrolled in Medicare or are opted out and not in the PACOS database, you don't have an NPI number, you're not in the PACOS database, there is a special CMS form 8550 for which you can enroll in Medicare for the sole purpose of ordering and referring. And there's the link to the website where you can get that. However, I note that it does require that you obtain an NPI in order to be listed in the PACOS database. There are some physicians like myself who don't have an NPI. I'm opted out and I don't want an NPI. If an opted-out provider elects to order and refer services, Medicare contractors must develop for the following information through an additional information request, and that involves requesting an NPI if you have one, a confirmation from the Office of Inspector General that you're not already excluded from Medicare. They want your date of birth and they want your Social Security number if it's not already contained in the affidavit. So they want some additional information from you if you're ordering and referring things, sometimes as an opted-out physician. And if the above information is not obtained, the opt-out provider will, and opt-out physician will not be able to order and refer services. If the opt-out physician refuses to report the information listed immediately above, then the opt-out physician cannot order and refer. But the failure to report this additional information does not affect the physician's right to opt out of Medicare. So if you're not willing to tell them your date of birth and so give them your Social Security number, trust it to these folks who may not be real reliable as far as where that information goes, that does not stop you or prevent you from actually opting out of Medicare. And for those of you who are watching this presentation on YouTube, as many are, I do note that we do offer Thrive Not Just Survive seminars a couple of times per year in various places throughout the country. This again is our Silver Jubilee 25th time that we've offered this seminar. And again, you can find all the details for registration on our AAPS website. Here are some tips for opting out. Start at least 6 months in advance of the beginning of the opt-out period. This provides time to inform patients of the changes, and it provides time for your staff to adjust. Filing the opt-out affidavit 6 months in advance of the start date or effective date also will allow for possible delays caused by the Medicare bungling factor. And the Medicare bungling factor is a very big thing. As Andy mentioned, I have a collection of correspondence with the Oversight Agency of Medicare and Medicare that stands 10 feet tall and weighs over 200 pounds, all for problems created not by me, but by the Medicare bureaucracy, usually from not following their own rules, regulations, and laws. So what you want to do is you want to send a cover letter, certified mail, return receipt to the Medicare carrier or carriers with the opt-out affidavit requesting written acknowledgement that the opt-out has been properly accomplished. If you don't do this, you know, they could just lose it, set it aside, say it was never properly accomplished, and then that whole time period that you were opted out and they didn't have it on file, you can be forced to go back, refund money to patients, file claims, big, big hassle. You also need office procedures in place so that no Medicare claims are filed except in urgent and emergency situations. And if you have any specific questions at all about opting out of Medicare or transitioning to a third-party free practice, feel free to call us at AAPS and we will do our best to answer your questions and help you. Thank you very much.